At the height of the pandemic, this was the outfit everyone wanted. And while many were panic buying toilet roll, governments around the world were panic buying PPE. But much of it in the UK wasn't up to scratch. Today, the Public Accounts Committee revealed that of the £12 billion the government spent on PPE, almost £9 billion will be written off to inflated prices and substandard kit. And an astonishing £4 billion of that stockpile could end up being burnt because it doesn't meet NHS standards.
The RCN collectively heard from many members who received PPE that was just substandard, aprons that were so thin that as soon as you went to tie them, they tore, they broke. They resorted to using bin bags, face masks where the elastic would break.
The report found procurement of PPE overwhelmed existing systems and exposed weaknesses. That waste included 817 million items of safety kit, which cannot be used, donated or sold. The department is now paying for the disposal of 15,000 pallets a month. It found nearly half of the PPE contracts reviewed were flagged as of concern, including one for £3.5 billion gloves, where there are allegations of modern slavery, first reported on Channel 4 News. But the Department of Health says the committee's claims are misleading and that only 3% of the PPE procured was completely unusable. And ministers make no apology for buying in too much of it rather than too little.
Close the loophole and prevent cronyism from corrupting our politics and wasting public money.
Those accusations continue to plague the government. However, the committee welcomed improvements by the department for taking steps towards greater transparency over conflicts of interest.
It's part of a consistent pattern that we've seen from this government for the last few years. For example, we know that about £6 billion was wasted through various grants from COVID schemes during 2020-21. The Office of Budget Responsibility now forecasts over £20 billion is going to be lost through the bounce back loan scheme, again through fraud and error. So there are consistent patterns across government whereby a lot of COVID spending and other general government spending has been done very poorly indeed.
And there's yet more accusations of government financial waste today. The National Institute of Economic and Social Research said Rishi Sunak squandered £11 billion of taxpayers' money. The think tank said the Chancellor failed to listen to their proposal that the Treasury take out insurance against rising interest rates in July 2021. But a Treasury minister said those proposals came with huge economic risk, would be an act of financial repression, and the figure itself is based on an almost impossible scenario. COVID-19 brought unprecedented public spending, but as we emerge from the pandemic, critics say there's unprecedented levels of waste.
Well, earlier I spoke to the Labour MP, Meg Hillier, who is the chair of the Public Accounts Committee. I began by asking whether the Department of Health's response that no apology was necessary for procuring too much PPE rather than too little was something most people would agree with.
Nurses, frontline care workers, people needed the PPE and they were struggling to get it. So, and of course, it was going to be more expensive. But what we've looked at here in much more detail is the whole way they procured it, the record keeping, the transparency of the records, and all of that is very poor. But they kept on procuring large amounts of PPE right through 2020, even after we were first laying down warnings about how they were doing it.
But I mean, late in 2020, your party leader, Keir Starmer, was still attacking the government for not providing enough quickly enough. I mean, given that it was an unprecedented pandemic, would Labour have done this any differently?
Well, look, I mean, they were pushing it through, as I speak for the committee, but the orders were still going through at very high rates and without all the proper protocols in place for procurement. Things got a bit better later on, but that was one of our concerns, that even after the first peak, they were still procuring large amounts at huge cost. And let's be clear, it was a lot of the middlemen making money along the way, people really profiting from this. So it wasn't even that it was always just the cost of the PPE itself, it was the cost of the people fixing the deals.
So when the NAO, the head of the NAO in the middle of the pandemic said that there was always going to be a trade-off between perfection and speed in procuring PPE, you accepted that up until a point? That's right. I mean, you know, there was going to be a huge seller's market across the world for this. But if you look at the ventilator programme, for example, when at the beginning we didn't end up using them,
but we understand that there was a need to get those. But there was a better process in place to cap the cost so that the British government wasn't paying more than it should do for those. It was paying more than it would have done in ordinary times, but it had a better process for controlling costs, and we just did not have that in place for PPE.
I mean, does your committee take a view as to who is to blame? Is it the politicians in charge of the department or the civil servants working within those departments?
Well, what we've looked at in this report is a lot of those processes that took place in the department about how procurement was run and the record keeping. But let's also be clear that the ministers were driving a very urgent programme. Remember the Turkish aeroplane that we were all waiting for? That kind of level of attention to detail by ministers shows that they are part of this as well, and everybody has to take responsibility for making decisions, and clearly we've got to learn lessons about this for the future as well.
And do you get any sense that ministers are taking responsibility, have taken responsibility for this?
Well, the Health Secretary at the time has written to the committee defending his position, but that was Matt Hancock. But, this is clear, the facts are there, the money went out the door, the money was spent, and what's critical now is we've got 9,000 shipping containers worth of this stuff, much of which is not usable, or even if it's usable, it's not usable for the NHS.
And of course, the National Crime Agency are looking into some of the contracts. Do you think there should be prosecutions?
Absolutely, where they're necessary. And I think, of all the contracts let, that's just over 360, nearly half are subject to commercial or legal discussion.
I mean, another extraordinary figure that is being talked about today is this estimated £11 billion that a think tank is accusing the Chancellor of wasting. It's very complicated about ending up paying very high repayment costs on borrowing. What's your assessment of that?
Well, there are quite clear rules about how government can use private hedging funds to manage it. Very often government self-insures against the risk of inflation or foreign exchange rates changing. So while we do look at this on the committee, it's always quite a finely balanced argument. And actually, it partly shows why government isn't the best body to be involved in sort of private sector financial arrangements, though it can use them in the right circumstances. But look, there's lots of waste that we look at on my committee all the time. A 7 to 17 billion gap in the defence equipment plan, lots of big projects that are delayed and cost the taxpayer lots of money. We spend our time looking at that, and we've got to remember it's taxpayers' money. And in the current cost of living crisis, every pound counts.
Meg Hillier, thank you very much for talking to us today.